All right, Rahima Moosa Mother and Child Hospital is turning 80. Can you believe it? What an incredible job they do. And to commemorate the milestone, the Footprints for Sam Trust wants to raise 80 million rand to renovate its all-important neonatal ICU, the hospital dedicated exclusively to the care of obstetric, gynecological and pediatric patients. Well, the Trust's Melissa Platt joining us now. Melissa, hello to you. Appreciate your time. What a wonderful initiative as well. I think people forget just how important this money is for the hospital. Tell me where the idea came from. Good morning.
Hi, Gareth. Good morning. So lovely to be with you and to be here with your viewers. Well, the idea really started with our son, Sam, who very sadly passed away in July 2016. And he spent his entire life in hospital, all 15 and a half months, and sitting at his bedside every single day. And then sadly, when he finally passed away, we just realized that as parents, we had to make his life count. And part of that, and part of our initiatives in terms of Footprints for Sam, is working in government state hospitals in pediatrics and really looking at how we can improve spaces, beautiful spaces under our Beautiful Memories project, where we look at how do we make a space of healing for children. And Rahima Moosa is a hospital really close to our hearts. Many people probably heard a lot of the negative press last year, and I'm sure there's lots more negative to come out of it. But it's an amazing hospital. She's 80 years, as you said, and the building is crumbling. And we need your help to really raise awareness with everybody that was born there, everybody that was trained there, thousands and thousands of people, South Africans coming together to turn this old lady back into a magnificent hospital that can truly save lives.
Yeah, the name known around the country, Melissa, and around the world, no doubts, as well. I love that, creating memories, because that's what this is at the hospital as well. Yes. How do we ask people to get involved when we say we want to raise 80 million for her 80th birthday for the hospital? How do we begin to do that? What exactly are you looking for?
Well, we're calling on corporates. We're calling on everybody who wants to have their CSI acknowledged in a really special way. And then on the doctors themselves and the allied professionals and health professionals that train there to really remember their alma mater and to put their hands up and say, we trained there and we're going to make a difference for the future generation of doctors and allies and professionals that are training there. Even paramedics started training in her beautiful hospital corridors about 10 years ago. And then also all the people that were born there. Even if you weren't born at Rahima Moosa, I was born at Park Lane Hospital. I had to check with my mom. But, you just think of the doctors that birthed us. They're probably trained there. So if we call upon thousands and thousands of people to just say even a rand or two, there are plenty of millions of South Africans that can make a difference. And I know that we can do that together. So to go onto Footprints for Sam and hit our How to Help page, and there's a wonderful page where you can just follow our EFT and bank details or even use your credit card and literally just put your name down and Rahima, and we'll make sure that your money goes to the right place.
Yeah, I just quickly logged onto the website as well, just for those who've just joined us now. I'm not sure if we have it bottom of the screen, but if you don't, if you haven't found it yet, footprintsforsam.org is where you can go and do that. And Melissa, as I start saying goodbye to you, is there a timeline involved here? Because I know we have to find 80 candles for the hospital, of course. Is there a timeline for this? We want to get it done before the birthday, on the birthday, or just give us a sense of how long we've got here.
Okay, so in March, 29th of March, which is actually the day before my birthday, she turns 80. So we are shovel ready. We have been planning this for 2 years. We've had amazing architects, Paragon Architects and Origin, who've helped us with project planning, a huge team. They put millions towards this. So they are biting at the bit. They've done it pro bono and at risk for us. So we are shovel ready. We just need corporates and we need all of you South Africans to come alongside us and really help us change this beautiful hospital. Our vision is another Red Cross hospital in South Africa. Rahima Moosa is the only mother and child hospital in the whole of South Africa. And between 14 to 17,000 babies are born there per year. And we've heard all the really sad things that have happened there and in many of our government hospitals. But as South Africans, if we come together, we can turn those into positives. We can not stand by the negative. All the brave voices that have pointed them out, such as Tim, they've raised the concerns. Now we need to act. We need to make a difference. And we all can, just by doing our little bit.
That's one thing to complain. It's quite something else to actually stand up and do something about it, Melissa, and you and your organisation are doing it. And I look forward to hearing from you, hopefully later in March as well, as we get closer to this target of 80 million rand for the hospital for her 80th birthday. The hospital, of course. Footprints for Sam's Trust. Melissa Platt joining us. Let me remind you again one more time of the website. If you want to write it down, go donate. Anything that you can donate will make a difference. Just head over to their website, Footprints for Sam. It's the number 4, footprintsforsam.org. I'm sure we'll touch base again with Melissa a little bit later in the